All right, so we're going to start with resource panel introductions and program overviews. And to kick it off today, so we do introductions and provide, provide program overviews provided and followed by Q&A sessions for the audience. Let's start with the Early Learning Hub and Danielle Stam-Thomas, and we'll learn a little bit more about her and the Early Learning Hub. So Danielle, I will drive the slides and take it away.
Thanks, Debbie. Hi, everybody. My name is Danny Stam-Thomas. I'm the Early Learning Hub Director for Clackamas County. I am seated at Clackamas County Local Government for the hub. My pronouns are she and her. I'm really excited to be here with you today. This is some just general information about Early Learning Hubs. Every region has one. There are 16 throughout the state of Oregon that are funded by what is now called the Department of Early Learning and Care. The concept of an Early Learning Hub is that we are the central coordinating body. We bring cross-sector partners to the table to work towards a shared vision and goals. We have 3 big goals. You'll find those on our website if you scan that QR code, all related to the concept that what we really want for children in Clackamas County is to arrive to kindergarten at kindergarten age, ready to learn. And the process that gets children prior to 6 years old ready for kindergarten is really about comprehensive support and services for families on breaking down barriers that children have to having their most successful start to kindergarten. In Clackamas County, we are working towards the creation of and implementation of streamlined systems that are easier for families to navigate. One of our big goals is to increase access to families. That is a challenge that is not small, given that there is simply not enough childcare, preschool, early childhood settings to serve the amount of children who are in Clackamas County. And a lot of our work is to make sure that wherever possible, we are increasing that access, that we are changing systems to make childcare more possible within Clackamas County. We also do enrollment for Preschool Promise specifically, or refer families to other high quality subsidized programs so that families can be served in a setting that makes the most sense to them throughout Clackamas County, and with a goal of improving quality overall, because a healthy Clackamas County is a county that serves all of its children. Next slide, please. So a big part of the work that my team does here at the Early Learning Hub is coordinating the enrollment of specifically Preschool Promise, which is a full day subsidized preschool program. This is an Oregon specific program, so it is paid for by the Department of Early Learning and Care. They contract individually with providers in each region to provide these services. At this time, we have 10 different sites in Clackamas County that offer these services for children and families. But all families who want to be placed at any of those 10 sites need to be screened and placed by my team here at the county. And we have an application that's available online under our tuition-free preschool page. You can find the links to the application. We do have it up in English and Spanish. We also have access to Vietnamese, simplified Chinese, and Russian for those who may need those applications in those languages. The concept here is there are 3 real big parameters that qualify kiddos for Preschool Promise. They have to be 3 or 4 by September 1st. This is a big deal. This means that somebody who turned 3 years old today would not be eligible to attend school in a Preschool Promise program. For this year, they would be eligible next year. And that is in line with what is requirement of school districts. If you are not of kindergarten age by September 1st, then you do not go to kindergarten yet. The other 2 requirements, you have to live in Oregon. Now, you can attend the Clackamas County program and not live in Clackamas County. It's a little bit different than some of the other programs, but you have to apply with the hub for whatever region you do want to attend in. So a family from Clackamas County, let's say they work in Multnomah County and they would prefer to attend a program closer to their work, they're welcome to do that, but they need to apply with the hub in Multnomah County in that case, because Multnomah County fills those slots. But they do have to, it can't be a family who lives in Washington or anything like that. And then the last requirement is that families have to have a family income less than 200% of the federal poverty limit. There's a chart on our website that will tell you what that is. There are several calculators. Many of the families you are serving probably will meet those requirements. Oh, and it says here 11 different sites. My apologies. Again, families must apply and be screened online with the exception of one of those locations, which is the Oregon Child Development Coalition. They do their own screening of children. If families apply with us, we will send the full application to the Oregon Child Development Coalition. That site is in Malino. Head Starts are permitted to do their own screening and placement because they have staff who are trained to do that as a Head Start site. That is the phone number for Preschool Promise, where you will reach one of the people on my team to ask questions. The folks on my team are available in English and Spanish. We have the ability to reach out to interpreters or other languages. All of the sites can be found for Preschool Promise specifically, can be found on our website. There are also brief snippets of the offerings that might be available to families outside of Preschool Promise, which include Head Start, Early Head Start, Healthy Families Home Visiting, many other programs that you will hear about today that I am super excited that we partner with. And I think that that's my last slide. Are there any? Oh, no, one more. Ha ha. Just kidding. You're going to hear a little bit about ERDC, so I'm going to skip that piece, but that is certainly an option that we try to point families to. In October, we will have some limited term scholarships available from the Early Learning Hub specifically. If you want more information about that, please reach out to me directly. We've secured some of the last COVID relief dollars to give out to families, and we've been slowly releasing them. They fund about 3 months of tuition at a licensed program. It is not a permanent solution. We recognize that, but we hope that at least 3 months of tuition supports a family getting started. We can pay for registration fees and helps them get a little bit established, or maybe pay their rent, catch up, make a extra car payment, get their oil changed, you know, all of those sorts of things. Childcare is expensive. And the unfortunate part of that is the lack of childcare in general means a lack of affordability, which also translates to there are not great solutions for every family. There are families for whom we cannot solve their childcare needs. We do not have a childcare to point them to that is going to meet the hours, the cost, the quality, the curriculum that families are looking for. And that is a huge thing that the Early Learning Hub and many of our partners are trying to solve, is moving the dial on access to childcare in general means more access, which will increase affordability for families. Any questions?
Well, Danny, thank you so much. And we'll hold those questions to a little bit later, but appreciate that. And I did forget to mention that we do have resources, and we'll be putting the presentation slides together and create access for everybody who's attending today to share with folks. So don't feel like you have to rush to write all that information down. It will be available to you. So thank you so much, Danny. And a great transition. We're actually going to hear from Mary Stewart over at ERDC. So I'm going to stop talking and pass it on to Mary. So Mary, please introduce yourself, and we're going to learn a little bit about ERDC. Oh, and you need to unmute yourself. Sorry.
I'm Mary Stewart, she, her, hers pronouns, and I am an eligibility worker at the North Clackamas DHS Self-Sufficiency Office. It's one of the 6 or 7 programs that we do eligibility for. And I'm really excited about sharing a bunch of the changes that have taken place this year. And you can go ahead and go to the next slide. ERDC, well, it's a state subsidized program. It provides assistance to Oregonians with childcare costs. House Bill 3073 passed in 2021, and we are just implementing it this year. But with it came some really amazing changes in the employment-related daycare program. And the focus is on family well-being activities expansion. And I think there was more to this slide. Can you click on it again? The person that made it so it can click. I hope I didn't lose it. Oh yeah, okay. So one of the areas is work hours, and I'm going to go over each one of these separately. Education hours have expanded, study time, authorized medical leave, and authorized work search. And now go to the next slide. So one of the great things to this expanded of work hours is it not only benefits the family, but it benefits the providers, because now all workers or all people that get ERDC, if they work 1 to 20 hours, they get approved for 20 hours a week, which is half time. So they can have a half-time spot. And then if they work or need through school, work, or other activities, if they do 21 to 40 per week, they get approved for 40, which is a full-time spot. So that's really helpful, because it's hard for part-time people to find daycare because nobody only wants to do 10 hours a week. So that's a great expansion. If families need more than 40 hours a week, they can receive up to 325 if there's a verified need. And some of those needs are sleep time, extra travel time. So that's a great thing. And then another one is that 2-parent caretaker households that are self-employed now qualify for over full-time hours if requested and need is determined. So people self-employed can also get this ERDC help. Okay, next slide. So the student expansion is very exciting to me. I've always thought that it's really hard. It's been a bad policy not to give students help with their childcare if they're trying to go to school and become self-sufficient. I mean, we're a self-sufficiency program, and yet students were never eligible, or they vary slightly. So employment is no longer required to be eligible for student hours at initial certification. Prior to January of this year, students could only get hours covered that were less than or equal to the number of hours they worked. So they had to work and go to school. And if they worked full time and they also went to school, there would be no hours left for them to use for school. So this is a great one. And then 2-parent caretaker households, their overlap can include hours from both of them working, both of them in school, or one working, one going to school. It doesn't matter, because we give hours for work and school. And then we can also give extra hours allowed for students beyond the 215. That 215 is the full-time. So if they are full-time work plus school, they can get extra hours to cover that. And student hours can be more than, less than, or equal to work hours now. So it really is very flexible with the students. And then caretakers that are 20 and younger attending local high schools, getting a GE completion, they're now eligible for student hours. And another really great addition is they get study time. So if they are going to school full-time, 12 or more credit hours, or hours of class time, they will get 10 hours a week for studying. And if they are less than 12 hours of class time, they will get 5 hours a week for study time. So and they just automatically get that. Okay, another couple of changes have to do with some of the authorized leaves. They can they can continue their childcare if they take leave from work to take care of a child in their household, a sick child. They get 3 months of parental leave after having a newborn, and they can request and also be allowed at initial and certification and ongoing if on leave from current employment for self or to care for the sick child. So it used to be if they are on medical leave and it's time for them to renew their ERDC, if they're not working, they weren't eligible. So this allows them to continue that through to keep the continuity for the child. Okay, so next slide. Then the authorized work search. So this is we've had authorized work search where they could continue their child care for 3 months while they look for work. Now they've added into this, and it doesn't really have anything to do with work search, but the parents can be eligible in limited circumstances when they're on leave to care for a child that is not on the ERDC case. So it might be a child that lives with their other parent. It allows them to still take time off to care for them. Next slide. So who is eligible for ERDC? And the program is for families that live in Oregon, are working or in school or receiving TANF, if they need childcare to keep working, attending school, or participating in family well-being activities, and that's for the TANF families. So if they are having to attend alcohol and drug rehab, services or mental health services, and they need to go be away from the children, then they cover that. And that was covered with the old TANF program, but it's also in this one. And if they have a child who is, those are childs that are eligible, they must be a U.S. citizen or a qualifying non-citizen. They must be under 13 years old and need child care, or 13 to 17-year-olds and need care because of special circumstances. So this would be those that can't be left alone while the parents work, and then they have to meet the income limits. And the entry level is the 200 under the 200% poverty level. It's the same as the SNAP program, but that limit, the exit limit, or when they have to leave the program, is much higher. So it allows them to promote, get raises, get a different job that pays more. So it does give them room for that. Let's see. And then I think that's my
Yeah, that's your
last slide, but I did want to add just a couple of things. So all of these things pretty much took place January 1st, but there were some others that were January or July 1st. But let's see, I wanted to say that one of the big new changes, and I just want to emphasize this, is families can be on TANF and ERDC at the same time. And that is something new. So, and so what we're doing now is the family coaches are sending their TANF recipients back to us to apply for the ERDC and get them on the ERDC. And they do not have to be working to get the ERDC. One of the things that Gabby had put as questions possibly to cover was, what's the best, fastest way to apply for services? I would say that probably the fastest, well, the best way and fastest way is 2 ways. Apply online and then call a local office to get an appointment, because they do have to have an interview. So either apply online or go to a local branch and then get an appointment scheduled. It is also possible to apply by phone, but the whole process takes a bit longer to do that. And we like to have them do an application because they think through it better than when they're on the phone, and so sometimes they leave stuff out. So we would prefer as workers that they do an application either online or in paper, but it's not required. And then best way to get information about ERDC is just to call our state line. This is for the Oregonians interested in it. Either call the the state line, which is the 800-699-9075, which has been the OHP number forever. So they know the number, but either that or the local branch. And as far as resource folks, you can call our office and ask to speak to an eligibility worker if you had questions about the program. We also have a website that has most all the information that you would need. Let's see. And then one last thing that I had left out of the slides is that this happened in July. There is a 12-month protection for the families. So the only way they could lose or have their case lose the benefits or close the case is if they request it, if they move out of state, go over the exit limit, income limit, and if there's no children. It used to be if they didn't get connected to a provider within 2 months, we closed their case. If they didn't find a job within 3 months, their leave would be up, that we would close the case. A lot of reasons we close the case. There's only those few that we would close a case now. They get the full 12 months. So it's just really exciting for us here working this program. All of the ways now, that we can help people and help people that in the past we could not help. So that really expands. So all of you that have, are putting together childcare, you're going to need a lot more because we've just really opened it up to a lot more people. And the copays are very low, like 0 to 20. So dollars a month.
Thanks,
So.
Mary. And we'll swing back to you here when we get to some of the question and answer discussion section.
Okay.
But that's all really exciting new information about the expansion of ERDC. So
it really
for
is.
share that with us.
Yes, thank you.
Yeah. And we're going to go ahead and transition now to Tiffany Nguyen Van, who is the Child Care Resource and Referral Navigator with Clackamas ESD. So Tiffany, take it away.
Thanks, Gabby. Hi, everyone. Again, my name is Tiffany Nguyen Van. I'm the Child Care Navigator with Clackamas Child Care Resource and Referral. My pronouns are she, her, hers. And so for today's session, I'm just here to give a little bit more information about what Child Care Resource and Referral is and just what we do here in Clackamas County. So Child Care Resource and Referral, or CCR&R, supports child care providers on their journey in early childhood education. And this includes offering professional development, technical assistance, and support in the Oregon Registry Online, or ORO, the Spark program, and earning licenses. And so for a little bit more information, the Oregon Registry is a statewide program that records and recognizes the professional development, growth, and achievement of people who work with and for children and family. And then ORO is just our state database that stores the submitted trainings and education to help verify with licensing requirements, for example. And you'll also find a training calendar, and just participants can access this at any time. And then the Spark program is Oregon's Quality Recognition and Improvement System. It's a voluntary program designed to support and recognize high-quality early childhood care and education programs. So just wanted to give some of those definitions out there. And then we also do our best to help increase childcare capacity through recruitment and retention. So with recruitment, some of the things that we've done this past year have been going to high schools and giving presentations on just what does a career look like in ECE, what is being a childcare provider, childcare professional. And we also are providing assistance on committees looking to create an ECE apprenticeship program. So those are some of the things that we're doing in recruitment. And then as is for retention, we do this through our training, the trainings that we offer, and just being mindful of like the commitment to quality improvement and hoping that, we are creating a better informed industry to help with that retention piece. Go on to the next slide. So under professional development, we connect childcare professionals to professional development opportunities for just a number of reasons. So getting their required hours for licensing and to help increase their knowledge in categories like special needs, diversity, health, safety, nutrition, just name a few. We also include, also provide networks, and these are just opportunities for our childcare providers to join together, be in a network to build their skills with free trainings, monthly evening meetings, and provide them with an opportunity to collaborate, share information, brainstorm solutions to common challenges with other childcare providers. These networks run for 2 years, and we currently are offering, these are offered by each CCR&R and are specifically designed to support the providers in just all the different facets of childcare. So for example, with Clackamas CCR&R, we're currently offering a network for infant and toddlers, and a business practices network, and a network for our Spanish providers. And so all of this it's for 2 years, and then these can all change just depending on what our providers are feeling like they're needing more support in. We also provide technical assistance, like I said, and that's just really us being a support system for them. So for example, if a provider needs help to become an ERDC provider, we can assist and connect them to the right resources. And just like what I've been doing these last couple of sessions, a really important piece for us too is just advocacy and doing our best to understand what our providers' needs are, then advocating for those changes that they need so that we can improve the industry as a whole for them and the children that they serve. And then lastly, that last little bit part of our name, referrals, we do some referrals. And while referrals have been mainly moved to 211, we do try to help referrals for parents who may need more assistance after they use 211. So yeah, that's just a little bit about CCR&R, and I'm happy to answer questions at the end, at the last part of this. And here's some of our contact information that you can refer to when you go back into the slides.
Thanks, Tiffany. And as Tiffany mentioned in her introduction, a lot of their referral services are within 211. So appreciate that smooth transition as I introduce Carrie Wells with 211, and she is a childcare program manager there. And I see you, Carrie, and I know you're looking for your unmute button, so don't rush, you're okay. But we will, if you're ready, we can take it away and talk about 211.
Thank you.
Yeah, and welcome.
So yeah, I'm Carrie Wells. I'm the program manager for 211 Info's childcare referral line. And for those of you that aren't familiar with 211, 211 is a phone number that is recognized nationwide for people to call. You can just dial 211 on your phone, and it's like a universally recognized number that people can call for social services, state agencies, community-based organizations. And so in Oregon, the 211 system is a statewide system. So we have a contact center that serves the entire state of Oregon. So similar to like 311 or 411, we are recognized by the FCC as a place to call for social services. And in 2016, the state of Oregon came to 211 and asked if we would begin taking calls specifically for childcare. And so what has happened is that we have a database that is full of childcare providers information statewide. So all of the licensed childcare providers, and then also childcare providers that just will want to be listed in the database. So we serve the entire state of Oregon for childcare referrals. And then we work in a partnership with Oregon Department of Early Learning and Care. They are who fund us to provide childcare referrals. We also work in a partnership with Oregon Department of Human Services, ODHS, to have listings of the childcare providers that are currently listed to take the ERDC payment. So a lot of families will go to ODHS and get qualified for ERDC, and then they call us for a list of providers that are willing and ready to take the ERDC payment from ODHS. And then we also work in a partnership with the local childcare resource and referrals. They are the ones that are entering those childcare providers into the database that we use, and also updating their vacancy information and other information about their programs. So we really are kind of a big system in Oregon, and we all work together. And so when families call us, they just dial 211 and they listen to the prompt for the child care line. We ask a list of questions, the location that you need childcare near, what kind of care you're looking for, the hours and days of the week, and then ages of the children that need care. And then any other information that's important to you in your childcare search. And then what we do is we ask if you'd like the referrals verbally over the phone, via email, or through text message. And so we can send you the referrals however you'd like. All of our referrals also come with information about what to look for in a quality childcare program. We send like a little checklist that kind of gives you ideas for questions to ask the childcare provider when you're looking for care, things to think about. And then we also can provide other basic family resources, we call them. So those are just other things that families might need. So along with childcare, we also often have families call us that can't afford to pay their rent, or they might need help with a utility bill that month. They might need children's clothing or parenting classes. So we work out of the childcare database to provide the childcare referrals, and then we can move over to the 211 info database and pull referrals for any other social service programs to find resources for families or whatever they're looking for. And then we have Spanish-speaking staff on duty during the busiest parts of the day. And then we also are able to use a language line for any other languages that come in outside of Spanish and English. And then we have extended hours. So we're open Monday through Friday from 7 in the morning until 11 at night. And then also on Saturdays and Sundays from 8 a.m. until 8 p.m. And then this just kind of gives an idea of the top needs that families are calling us for. So they're always calling for childcare, but then on top of it, these are the additional things that I was talking about that families are asking for. Childcare expense assistance, which would be basically help paying for childcare, or people looking for programs that provide like free childcare or preschool services. We also get a lot of calls from folks that are looking to have help with getting a friend or a family member listed to care for their child. And so we refer them over to their local childcare resource and referral, sometimes to the Department of Human Services to get listed with, to fill out paperwork and get background checks and things like that. And then other support services that families ask for often are services for families that have children with higher needs, special needs, disabilities, things like that. Rent assistance, Head Start is a top referral for us, utility assistance, a lot of families calling for help with food, childcare complaints. Sometimes we get calls from families that are looking for a new provider because something might have happened in the childcare where they're at, and they don't know who to call to make a report about that. We make a lot of referrals to WIC and then also to parenting classes. And then this is just showing, this is something that comes with the childcare referrals that are emailed. It's kind of a guide for families. The next slide is my favorite piece of this document. And this is the one I talked about that it's like a checklist, and it's got questions to ask when looking for childcare, things to think about. And so it's a great piece of information for families to just look at and kind of get their thoughts on paper around what it is that they are looking for and what they care about in the program. We know that, you know, every family has different values and different things that they are looking for in a program. So I like how this kind of leaves it open-ended for the family to really think through what is important to them. We don't always know. We like to give families choices, basically, in the list that we provide of childcare. So we do have to give at least 3 childcare providers in a list to families. And that is basically so that we're not considered as like recommending one specific provider over another. So our lists always have at least 3 providers on them. And then we are kind of like not supposed to give a list of more than 10. So it's generally 3 to 10 providers at a time that we provide. And if those don't work out for you, you're always welcome to call us back and we'll keep sending more lists for you. We also can't guarantee that the provider has a vacancy. And I know this has been spoken about a few times in the other parts of the presentations, but there is a shortage of childcare in all of Oregon. And so sometimes it can take a while to find a provider that has openings. So we definitely welcome you to keep calling us back again for new lists. You never know when a new provider might actually become listed in our database, or they may have currently not have had a vacancy before, but now they do. So next slide.
That's
it.
it. Yeah, no, thank you so much, Carrie. And we'll, I'm sure, have some questions for you, but appreciate you sharing some of this information with us.
Thank you.
Right, and last but not least, we're gonna invite Alex Bersheim from Sunshine Early Childhood Care. Am I saying that right? I'm gonna see. Nope,
Sunshine Early Learning Centers.
I was
Same
getting
thing, though.
close, but my apologies, Alex. But take it away, and thanks for being here.
Okay. Yeah, hold on, I'm just gonna close this so I can see all my slides. So I have a lot of QR codes in the top two. If anybody needs to scan those, it goes to either our website, how to enroll. Each page will have a different QR code that's helpful. So just wanted to point those out in the beginning. But basically we have 3 centers. We have 2 located in Milwaukee and then an Oregon City site. So we have Sunshine on 21st. We have Sunshine on Harrison. I'll kind of break down the differences between these sites too, because we have a lot of programs working, different programs working within them. And then we have a new site in Oregon City that people might not know about. It's not open yet, but we hope to open within this month. So that's good for families that are looking for care. Have that on your radar. We also accept ERDC at all centers. And then we have a lot of other cool funding opportunities sometimes. If families don't qualify, we have in-house scholarships. And then I put on here that we're hiring, but I just wanted to say that if you have parents that are looking for work, we offer discounts also. So that could be a way to help pay for care as well. And you can go to the next slide, please. Thank you. So Harrison has 64 slots for Preschool Promise, and we follow the same as the hub. She gave all the qualifications later, so they actually do our enrollment, so you have to call them first, but we only have about 40 filled at the moment, so there's no wait list. So if you have parents that are looking for care, they possibly will qualify if they meet those qualifications set earlier. And then our program works a little bit different than others. We have 8 to 3 Monday through Thursday for the Preschool Promise, but we do have some summer programming available if they have ERDC. So not all the Preschool Promise families go through the summer, but we really try to provide that continuous care for our families in that way. And then we also have aftercare that's available if parents have ERDC or if they want to pay for it. So then if they have like an extended work day, they could have the program from 8 to 5:30 instead of just 8 to 3. I'm the family advocate also, and we have a nonprofit program that helps families connect with basic resources. We have some money in-house to help pay for rent and things like that. So that's different from other daycare programs, and just has like that extra service connected to it. And then at any time they can enroll through the hub. So we had kids that we were taking like a week before our school year was over. So if you can at any time tell a family that they can enroll through the hub. And then we also have the Oregon City location that will have 30. Now we just got approved for 30 Preschool Promise slots, and there's only 2 filled there. So that's a big one. Let families know if they're looking for care in Oregon City that we will hopefully be opening within this month. So that will be happening soon. And there's no wait list. Same kind of thing. They have aftercare if the parents have ERDC. And then I am also supporting families over there as well. And I think now is probably the best time to apply in general if they want care throughout the year. You can go to the next slide. And then we also have at our Harrison location a partnership with OCDC. So we have 18 early Head Start spots there. And this is a really cool model because it's completely free and it's 5 days a week and full-time care, full calendar year. And then they also still get all the supports that early Head Start or Head Start programs provide. That's not through me, that's through an OCDC family advocate, but it's a lot of support and check-ins and extra good stuff. So there's I think 1 slot available right now. I don't know what age group it is, but the wait list is open. So I can't really gauge how long people are waiting on the wait list, because some parents, just depending on the age and the slots that come available, it's kind of the tricky thing of childcare. Sometimes somebody moves and there's a slot in that age range, or they age out and then we have a lot of spots. People go to pre-K, kindergarten, and then we have a bunch, but it's hard to gauge. So we don't promise parents like a certain time either. But that QR code starts the intake process with OCDC. So they do all of that enrollment as well. We don't do that. And then the next slide, please. So then at our other locations, we have all these other options. Oregon City doesn't have a wait list at all right now because we're new. So we have 6 weeks to 12 years. And they can either private pay or they can use ERDC to pay. And that's a 5-day-a-week program. I gave the phone number of the director there. If you want to jot that down or give that to parents, that's the best way to apply with them. 21st location, they don't have Preschool Promise or Early Head Start, but they do have an open wait list. So if for all ages, they have school age program as well. So that's the phone number there if you want to get on the wait list for that. Or Harrison also has some of those ERDC or private pay options. So we're kind of an interesting model of childcare. We offer free, we offer for-pay, ERDC. We kind of take all the things at our centers, which isn't always the case for daycare providers. So, and then just some tips or tricks that I wanted to suggest is if you know someone is going to need care and they're pregnant, to have them get on a wait list as soon as possible. The sooner the better. It's a lot better to get into an infant spot than to wait. It's just harder after that. Then it's like easier again once they're 3 because the ratios change. So it's best if they get in as soon as possible and get on those wait lists as soon as they can, since we know it's a childcare desert in this area. So that was just kind of a trick I was thinking of. Also, we do have Spanish speaking teachers at our Harrison Preschool Promise location. So if that's something a family is wanting, we do have Spanish speaking providers at that location. So, oh, and then payment stuff. We do payments through Brightwheel. We walk parents through how to do that, but we're pretty flexible. We can connect to their bank account. They can split it up if they want. They can do cash payments and get a discount. We accept checks, but we're really flexible and we offer a lot of discounts. So if a family is needing support, we will work with them. They just need to communicate that with us. So there's a lot of options. And then I think the last slide, if you want to click again. So our nonprofit that we started, we had a lot of families coming in and looking for rent and utilities and different things after kind of all the COVID money ran out. And so we decided to start a nonprofit for just our childcare centers. And we've got some grants and some donations and been able to partner with more community agencies so that we can help anybody in any of our programs with rent. We helped with car repairs, safety items, utility, really just like full family support. Anything that they might need, we try to get a hold of for them. And then we also were able to start partnering with more community agencies and providing things like dental screenings for all kids in our programs. So they get dental screenings 3 times a year, so that we can make sure they're connected to a dentist, but they're also screening for early cavities, things like that. And that is totally free of cost. I included our Facebook and our Instagram on here because that's kind of our resource sharing hub. So if there's anything that anybody wants to share that they want me to share on our Facebook with our families, please, you can email that to me, send that information to me, and I will share it right away. But also share with families if they just want to see things that are going on with child development, community resources in the area. I do a lot of that. And then there's a little PayPal code if anybody wants to donate to our diaper bank that we're trying to fill right now. But yeah, don't feel pressured. And then I think that's it. If there's any questions, I guess we'll take it
Yeah.
at the end
Yeah.
Cool.
Thank you so much, Alex. And
Yeah.
I saw everybody's heads go down as they wrote down whatever location does not have a waiting list right now. So
Yeah, right.
there might be one shortly. I don't know. But thank you
We'd
so
love to
much.
have that happen.
Yeah, exactly. Exactly. So, and this is actually a great transition because it is our Q&A time with the resource panel. So if you want to unmute yourselves or raise your hand and have some organized chaos, I can choose you all and ask away. But we also have some questions that we came up with too, in case people are shy and are on the struggle bus at 4 o'clock in the afternoon. So anybody in the audience have any questions to kick us off with? Go ahead, Crystal.
Alex, I have a question. Are all your centers ODHS? Like, I might have missed that, but are they on the list for ODHS? And if not, are you guys planning to be?
I think so for ODHS. Yeah, and we're connected to the CCRNR. Maybe Oregon City's not yet because it hasn't quite opened, but they're all registered childcare centers.
Thank you.
Yeah.
I have a question. What is the biggest mistake you see parents who are seeking childcare make in finding, suitable care for their kids? Or what is something we can prevent somebody from doing that would make their life easier?
Is that to me specifically or just to everybody?
Sure, Alex, or anybody who knows the answer, because I get a lot of questions and I would like to save them some trouble.
Yeah, it's not anything that parents are doing. I don't think it's really just that there's not enough childcare, and depending on the age, a ratio for a little one under 2 is 1 to 4. So one room can only have 4 infants in it. So when you think of the under 3-year-old category, they have to have a lot of rooms all over the county to support all the babies that are around. But that's why I said get on a wait list as soon as possible. Like, even if you're like, I don't even have a job yet, just get on a wait list. Just have yourself on all the wait lists that you can. And you never know what could happen. A family could move or anything, and you could get that spot. So I think that's really not following up and putting your name on those wait lists is important, in my opinion. Maybe someone else has some advice too.
Great, thank you.
I can add a few things to that. I would say, just for the knowledge of everyone in this group, our childcare desert for children under 3 in Clackamas County is massive. There are 12 children under 3 for every license spot that is available to families in this county that serves that age group. And so simply just sheerly not enough. And that means that's what necessitates the need for getting on wait list early, because if you wait until your baby is born, you haven't been on that wait list for 6 months already, and a spot might open in another 6 months to a year, but you'll be too far down on that list. And so it's unfortunate, but super true, that if you have a child under 3, that is going to be the most challenging to find childcare in Clackamas County. I think the other thing that we've super encouraged parents to do, there are many, many kinds of childcare. Some of them are licensed and regulated by the state, some are not. All are valid options and choices, but families should really know what kind of care they're signing up for so that they are familiar with who is regulating, if anyone's regulating, who's watching, what are the requirements of that program, so that they can make sure that that aligns with what they're looking for.
Mary, I think I saw you unmute as well.
Oh, yeah. Yeah, I agree with Danny. I think getting to know the different types of childcare providers that are out there and what it means to be licensed versus exempt, things like that are really important, just because I think sometimes families don't understand that there are some providers that they think because they're listed like in our database, that they have gone through maybe more training or background checks that they haven't gone through. So just kind of sorting that all out and doing your research is really important. But also I also agree with Alex, like families sometimes call us and they think they're doing something wrong, and that they're just really upset or sad because they can't find a provider that has openings, but just knowing that they're not doing anything wrong, like it's a systemic issue, actually all over the nation, and there's just not enough childcare. But at the same time, we also hear from families that didn't think there was anything else in their area, and then they call us and we do have more listings than the providers that they knew of. So a lot of times people only know of like this big center that is in their area, and then they know that that one's full. But then when they call us, they find out that there are other like home-based childcare programs in their area that might actually have openings that they didn't realize they would be interested in. So yeah, just getting started researching and figuring things out early, I think, is the best way to go.
Yeah, and I think if any of those are here today that were in our first learning session, all of this rings true, right? This was brought up in conversation. And I mean, I even, when Alex said, get on a wait list when you're pregnant, even though I don't have children, to me, it's like, I'm sorry, what? And I think a story was shared in our first session about how, you know, to a couple, they had a baby, but they were not on a wait list, but they, you know, they had the means to pay for childcare, all that stuff, but they weren't on a wait list and they had to wait. So it's no longer about whether you can pay for it or not. It's in addition to that, it's whether there's any spots. So yeah, very message heard loud and clear on that one. So thank you for that feedback. Other questions, and great question. Thank you, Josh. Yes, Crystal.
This actually came up in the conversation that I had with someone, but when it comes to like childcare, but specifically for children who have special needs, is there like an additional process, or are all centers equipped to, like, you know, work with different types of families who have different children who have different needs? So out of curiosity about that.
I can say a little bit about that too. So our program also, we have a behavior policy, and we didn't expel any children last year, but a lot of kids come to us that have been expelled from other daycare centers. We partner with Early Learning ESD. And I think that's really helpful if parents get connected with them first and have that service, so that we have the extra support and the specialists that are working side by side with us in the school. That's really awesome. But I think that ERDC, maybe they can take over this question. They will pay a higher rate also if the child is, if has that IFSP. But that is a huge struggle. If you have parents looking for a higher need of care, I would say we do a good job of that, but not everybody can.
Yeah, I'll jump in on that. There are two levels of special needs. So there's a special needs and then there's a higher special needs, but those, if children qualify for that and really they just need verification from a healthcare provider or a school, the provider gets paid more so that they can afford to provide the extra, maybe the extra person or whatever they need, the extra, and then they provide also more trainings for those providers, can get extra training through the state. So now it's the DELC, they take care of all of that. So there is training for providers available for the providers, and then we pay them more if for children that have those extra needs. So, and that's one of the questions we always ask your child, does your child need, do they have special needs? And if they do, then we can move on with that. And if not, just keep going forward. But that is one of our questions when we do the interview with parents.
Thank you, Mary.
Mhm.
Do you have a question here? Danny, were there any changes this year for qualifications to the Preschool Promise program? Or anything that you wanted to talk about, alternatives for families who don't qualify as low income? What are some of their options for accessing childcare?
Yeah, that's a interesting question. We got to celebrate last year the expansion of ERDC to include more families at a different income threshold than before. We have not, unfortunately, got to have that celebration with Preschool Promise just yet. It is still number one on my list of things to advocate for in terms of Preschool Promise. We know that families all the way up to 350% of FPL are struggling to pay for care. Care is expensive, it's hard to find, and that makes it more expensive. So families are just struggling, and there has not been a significant investment from anywhere to support that outside of ERDC, which is a really wonderful thing. And I'm so glad for the expansions that came to that this year. But families, they need more. They need more options, and we're trying to explore what buttons might be possible, increasing the FPL a little bit on Preschool Promise in a future legislative session. But those three basic requirements that you have to meet, those are mandated by state law. So without a legislative response, the requirements for Preschool Promise do not change, and that 200% FPL stays the same. I mean, the number goes up a little bit because 200% of 2023 is a little bit different than 200% of 2022, but not a lot, unfortunately. And FPL is not the best metric to be using to determine, particularly with inflation and all the things that are facing families. It does not give an accurate picture of economically what it is for a family to be able to make do these days. And so it is just not a perfect or even good representation of what that is. So unfortunately, we do have some scholarship money available that will be coming in October, as I mentioned. That is able to serve low to moderate income families. So that uses a HUD guideline instead because it's emergency money, which is a little bit higher than 200% of FPL and is based on the median area income of our county, which is very exciting. And that is where I'd hope most of these things can move towards. This median area income really gives us a more accurate representation of what is affordable based on the cost of living where we live. And so those are all things that are hopeful. And it is super unfortunate that some programs will have sliding scales. There are programs in places that are offering free services. Some school districts, families should always reach out to their school district if they're struggling with this sort of thing, just to sort of find out what their school district knows. Because some school districts will offer a discounted program. Estacada has done that in the past. Colton is doing that in conjunction with their Preschool Promise classroom that are still fee for service, based, but a slightly different fee scale than what you will find in full-time care. That is really uncommon in any other kinds of programs that are not at least somewhat subsidized in some way. Most of the other free sort of offerings are going to be like part-day preschool, not really necessarily meet a child care specific need. Head Start is certainly an option. It does not have, it has income requirements. You can income qualify for Head Start. You can also categorically qualify, which means if you're experiencing significant life changes in your family, someone's unemployed, on certain kinds of disability or certain other like family stressor type situations, those are options. The one other that I didn't mention, we do have a relief nursery in Clackamas County that does offer part-time sort of relief and respite care for families who are sort of in that high trauma stress sort of situation. So it's very specific group of families, but that is definitely a resource that's available. And families can go through that screening process to at least obtain a few hours a week where a child would get a socialization experience inside the classroom and give the families a little bit of relief.
Thank you, Danny. The last question, this is for all of our panelists, and Josh sort of preemptively asked it in the beginning, but want to give a chance to all of those that are here today on what is one thing you would like families and or resources providers to know about childcare, specifically from your lens? I'll call on Tiffany first.
Okay, let's see. Well, I guess with my role specifically, I've really been able to see just what families are going through right now. And thankfully, I have a privilege to be able to help them in that I make those calls for them. And I don't stop making calls until I get a yes for these families. And that's a very privileged place that I'm in. But when I'm making these calls, and what I hope that I can at least share with families about the strategies that I have used is just like calling during nap time for providers. That's when you're more likely to get an answer on the phone versus a voicemail. And just because you get a voicemail, I would just keep calling every day until you get somebody, because providers are busy. That's just part of the industry and the work that they do. So it's very hard to get back to parents immediately. And so I would just try to keep calling until you get somebody, and not just rely on the fact that you left a voicemail. Right. Like, it's just important to keep that going. And I know that that can be very tedious for parents. I know we're asking them to be very proactive in a situation where time is not available. It's not that it's all of this is so unfair. And I really feel for the parents that are going through this. And so I think that, again, like I mentioned in the second session, it's all stars aligning, unfortunately, right now, and how you find childcare. It really is that someday you just find it because you called at the right time on the right day with the right provider, and it just so happened to be that there are slots. And unfortunately, if you have more kids, it can make it more difficult to find childcare. If you have all really young kids, it can make it really hard to find childcare. So again, really, stars are aligning, and unfortunately, there's no easy, quick answer to all of this. But I hope that, with all of us here, all of these opportunities create these partnerships, just know that we are doing our best, and we're here for the families, and we're all in this together, right? Sorry to sound like a High School Musical thing right now, but we are really all in this together. So,
Thanks.
So yeah.
Thanks, Tiffany. Mary, what would you like? What's one thing you would like families or resource providers to know?
Well, I think just definitely refer them to us to see if they're going to be eligible for the ERDC, because that helps take one piece away. It doesn't mean they can find childcare any easier, but they do, you know, we can help them with the cost. And so, and we go up, you know, our limit is same as yours, Danny. It's the 200%. And unfortunately, working for it full time, a lot of people are over that. So, but it's a great program for those that are part-time, you know, so, or yeah, but yeah, come and see. I mean, the only way they'll know is if they come and they apply, and we can go through it with them. And I appreciate some of these resources to help give them maybe the next step. You know, where do they go? What do they do? I mean, we use 211. And I just have a quick question if I can ask.
Absolutely.
Carrie, do you know about what percentage of the providers accept ERDC?
I don't have like a specific number right now. I'd have to like run a bunch of reports to see specifically, but I do think that off the top of my head, probably like the majority of the ones we have in our database have either said that they're willing to accept, which would mean they would have to go through like the background check and fill out the paperwork and everything, or they are currently listed. So
Okay,
the
that's
majority of the providers that we have are willing or currently listed. Yeah.
Okay, good.
Well, since we're on you, Carrie, what about you? What is one thing you would like providers or resource providers or families to know?
Sure. Well, kind of to add on to what I was saying about to Mary about the ERDC providers in our database, I just wanted to mention that sometimes people think that they can only call 211 if they are within a certain income limit. You know, they only can make a certain amount of money, otherwise they're not allowed to call 211 for help. And I just want to encourage everybody that, like, no matter what your income level is, whether you're over income for ERDC or very lower under income, or, you know, have a very low income, we have resources listed for everyone. And so don't be afraid to reach out and ask for help. And I think that's kind of my main thing is like, don't feel like you have to do it all on your own. Like, please reach out and ask for help. We partner with a lot of different resources throughout the state. And that's what we're here for, is to help. So everyone is welcome to reach out and ask for help with this, because it is difficult.
Thanks, Carrie. And Alex, do you have anything to add to some of the tips and tricks that you had already given us?
Yeah, I would just mention also that most childcare places are short-staffed. A lot of people left the childcare industry after COVID, so that's something that we're struggling with also. Just as a little perspective, you know, if you're calling and not getting a director, it's probably because they're doing a break for someone. So always call again. And for people helping coordinate with families, just have them start early, and try lots of different options, you know. It doesn't hurt to keep calling or keep trying, but start as early as you can. I think that's all.
Thanks, Alex. And thank you to Danny and Carrie, Tiffany, Mary, for your time today and answering some of those questions. I think it supports the message that we've been sharing throughout this learning series, but also I think is more impactful when we hear it from those that are working either directly with parents or folks that are waiting and trying desperately to find childcare. And to Tiffany's point about all of us being in this together, really felt that today through our time together. There are just a few other additional resources that I wanted to share with folks for people who weren't able to attend with us today. And please know that these slides will be available for folks who want to contact or learn more about them. The early intervention childhood special education group. Tiffany, did you want to share just a quick minute about who they are and where they exist?
Yeah. So we have one here at the Clackamas Education Service District, but they are available throughout the county, to all the different counties. But basically, they provide services that support developmental and educational needs of children's ages birth to 5 and their families. And evaluations and screenings are free for children ages birth to 5, and they can find out, if they're eligible for free services, and they work alongside caregivers and teachers. And I think Alex, you mentioned that in your section, helping providers and helping them help the kids who have these who have special needs or disabilities. So.
Great. I think we called out Head Start, and unfortunately they weren't able to be with us today. But here's some information about them, and we will also provide, there's some flyers that we will be sending and our resource kit, once we get all of that together, that you will have their information about the different programs that they have and enrollments. Here at Clackamas Community College, Oregon City campus, we do have a family resource center where the YMCA exists. And there's childcare opportunities there. In addition, there is a parent support group that is starting. I don't know, Danny, if this is in your world or not. I think it's with the Morrison group, but they are offering, might even be CFCC, sorry, Children Families. Do you know anything, Danny? Okay, I'm just picking on you, but yes.
You feel free to pick on me. I am part of Children Family Community.
Okay,
Connect,
yes, you are. I forgot.
I am, but I don't know anything about this.
Okay.
So. Sorry.
Yeah, but so it looks like there's a safe place for a parent support group. And so we wanted to share that with everybody. And just another way to support our families. And last but not least,
sorry, I do. It said on there that it's done by 4D, and that is usually for parents who are in recovery.
Oh, well, there you go. Thank you. Thank you. Another resource. And that concludes our presentation session for today. We cannot learn and grow together or without you if we don't get feedback. So I'm putting in the chat a link to a survey that we would love to hear from you about all the content that was shared today, the structure of the presentations, but also ways that we can continue this conversation. We are in the early stages of finding out how we can partner better with Danny's organization, where there are some communities of practice, not just for families, but for those of us that do work with families, and how we can learn from each other and how we can grow. There are other opportunities like that out there, but please, if you have the chance, fill out that survey. And from all of us, thank you.
Gabby,
and yes,
the link to the survey is broken.
Uh-oh. Hold, please.
I'll help you figure it out. We got this. We got this. We're in this together. Don't worry.
Okay, there's another one.
Okay, let's see if that one. I hope that one works now.
Can you try that one that was in the chat? Thank you for keeping an eye on that. Thank you. Thank you. Okay, that one works. Thanks. So thank you all for that, and really appreciate you all being here. We will let you all know when these videos and resources are available to the public, and we hope to hear from you soon. So thank you so much, and have a good rest of your afternoon.